So thank you. Thank you to all the experts who have stuck with us today. And thank you to all the patient advocates and caregivers and families and the medical professionals who support them. It takes a lot to get legislation to committee and then get it actually heard in committee and get it moving along. So congratulations to you. We have a little more to do, though. And I want to thank the committee for including two of my bipartisan bills, especially the bipartisan and bicameral Shine for Autumn Act. This bill is not new to the committee. We passed it before, but the necessity for passing it into law remains urgent. The bill is named after Autumn Joy, who was born still on July 8th, 2011. And her mother, Debbie, has turned Autumn's tragic death into a mission to increase stillbirth awareness and education and ultimately decrease the number of families who experience such a heartbreaking loss. Stillbirth is a public health crisis in the United States with over 21,000 stillbirths every year. That's almost 60 babies every day. This exceeds the number of deaths for children aged 0 to 14 from guns, accidents, preterm birth, SIDS, drownings, fire, and flu combined. And like too many other maternal and child health issues, there are persistent and long-standing disparities with Black women more than twice as likely to experience stillbirth as white women. At least 1 out of every 4 stillbirths are estimated to be preventable, but there's still so much that we do not know. That's why we need real change that will lead to measurable improvements in the outcomes for families. The Shine for Autumn Act would improve surveillance and data collection relating to stillbirth nationwide and invest in research to examine the causes and risk factors. Additionally, it would seek to increase education and awareness. American parents deserve better data and science to help improve pregnancy outcomes. And I'm proud to lead this legislation with my colleagues, Reps Young Kim, Robin Kelly, and Dave Joyce to keep the memory of Autumn Joy alive. Together, our committee can address the serious maternal and infant health crisis that is tearing families apart and causing significant pain and trauma. At this time, Madam Chair, I'd like to ask unanimous consent to enter into the record testimony from Debbie, who has really spearheaded this effort, and I know she is watching and listening today. And a thank you from the 300+ endorsing organizations of Shine for its inclusion in the hearing.
No objection.
We need a clearer picture on why babies are dying if we want to make progress towards reducing stillbirth rates and improving outcomes. With timely and accurate data, we can begin to understand the underlying causes of stillbirth and guide policy actions and much-needed strategies for prevention. I'd also like to highlight another bill of mine on the agenda, H.R. 6960, the Emergency Medical Services for Children Reauthorization, which I led with Reps Carter, Schreier, and Joyce. Our bill would reauthorize the vital EMSC initiative for another 5 years at the current funding levels. I have the privilege of co-chairing the Children's Healthcare Caucus in the Congress, and I have learned over the years from a lot of folks like you that children have specific healthcare needs, including in an emergency when there is little time to spare. For the past 40 years, EMSC funding has spurred innovation and advanced research to address the unique needs of children in emergency medical systems, saving countless lives and improving health outcomes. EMSC benefits children every day, in every state, in every territory. And here's an example. Back home in Florida, EMSC served 4.3 million children and their families. You all may remember that monster Hurricane Ian when it was bearing down on southwest Florida in 2022. They evacuated 81 critically ill neonatal and pediatric patients from local hospitals. And we knew that the transport vehicles were properly equipped at that time thanks to Florida EMSC Safe Transport Work Group's earlier distribution of hundreds of pediatric restraint devices. Using this kind of resource, it allowed the Disaster Response Committee to develop a pediatric mass casualty triage tool that has been distributed. So I'm grateful to everyone that has worked on this Thank you very much. And I'd also like to ask unanimous consent to submit for the record a letter of support from the endorsing organizations for HR 6960. And thank you
No
all again
objection.
very much.
The lady's time's expired. Does she yield back?